Hi, everyone. Again, my name is Heather Gavris, and really delighted to be able to join you today to have two wonderful guests join us as part of our series of webinars. This is actually our second webinar since July of this calendar year, and it was really on a focus of implementing Healthy for Life within food banks as well as food pantries. Again, I'm Heather Gavris. I serve as our National Program Lead for the Healthy for Life initiative, and will be serving as your facilitator today. During our webinar, certainly all of the attendees are currently muted. We will be using the question and answer function within Zoom to log your questions. If you're not as familiar with that, please just know it's the icon located at the bottom of your screen. So as I mentioned over the chat function, we will be sharing both the webinar recording as well as the PowerPoint in the near future. We have traditionally posted those on the Healthy for Life Facilitator Hub, which, as many of you know, is our kind of go-to resource for gaining all the resources and materials affiliated with Healthy for Life. The objectives today are that you're going to be able to learn from two nonprofit organizations that have been utilizing Healthy for Life as part of their nutrition education efforts, and then certainly have the opportunity just to address any particular questions that you might have related to working with food banks and food pantries. If you could go to the next slide, I would love to just introduce our two presenters today. The first presenter is Tiara Turner. She is the AmeriCorps Program Manager with Catholic Charities USA. And certainly prior to joining Catholic Charities of USA, she had previous experience working with the food and nutrition programs. In particular, she had served as the Emergency Food Assistance Program Coordinator for the Capital Area Food Bank of Northern Virginia. And in that role, certainly she worked with a large number of clients, ensuring that those individuals were receiving the supplemental food assistance that they needed through a variety of the USDA offerings. Our second presenter is Rebecca Collier, and she is the Nutrition Services Manager for Harvesters, which is the community food network based in the Kansas City region. She's had over a decade of her career as a registered dietitian, educating individuals at all stages of their life around healthy food and eating well. Prior to joining Harvesters, she worked in both community as well as clinical nutrition settings, as well as being a community college adjunct professor. Certainly in her volunteer leadership opportunities, she's been engaged with the State Dietetics Board as well as the University of Missouri Extension Council. Certainly Rebecca believes that healthy food should be accessible to everyone. And she and her team take great pride in partnering directly with agencies within Harvesters Network in creating and encouraging more healthy choices for their guests. So really delighted that both individuals were able to carve out time during their day today, which is a very busy time of the season for sure. To get us started, we do have a poll in which we would like to have our attendees participate in. And so the poll question is, what is the current prevalence of an American Heart Association healthy diet score in the United States? So as you're looking at the responses, I want to keep in mind that a healthy diet score from the American Heart Association is really looking at consumption of fruits, vegetables, and whole grains, as well as fish, and then also limiting sodium as well as added sugar. So we'll give individuals maybe just a few more seconds to participate in our poll. Great. So, majority, it's sort of evenly split. So about 40% are saying 5%, close to 30% is less than 2%. Another is at 10%, and then certainly some individuals are thinking it's greater than 20%. So right now it's currently at 1.4%, certainly between the years of 2003 and 2004, and then again in 2015 to 2016, the mean average of the American Heart Association Healthy Diet Score did slightly increase, but it's still at 1.4%. Now, the good news is we have seen an increased consumption of whole grains, beans, and legumes, as well as a decreased consumption of sugary beverages. So that's great. But we haven't really seen significant changes as it relates to fruits, vegetables, and fish consumption, as well as just reducing sodium, processed meats, and saturated fat. So thank you for joining the poll today. So just to get us started, I would like to provide a review of the Healthy for Life initiative. So as you might anticipate, just that prevalence of what's considered an ideal diet based on the American Heart Association, Earmark, as well as the American Heart Association, really saw an opportunity in 2015 to come together and generate an initiative that would ultimately improve the health of Americans by empowering people to make the healthy food, nutrition, and lifestyle choices. And that is really focused on improving that culture of health, not only at an individual level, but also at an organization, community, and national perspective. As part of our working relationship, we actually have kind of four main focus areas, one of which is around menu impact and innovation. And at the time of announcing our relationship in 2015, we collectively indicated that the menus across Earmark's food supply were certainly going to be looking at a reduction of sodium, saturated fat, and calories at the same time of improving by 20% fruits, vegetables, and whole grains. To date, the great news is they have met that goal in terms of menu impact and innovation, and are continuing their collective efforts and continuing to improve the menu just through innovative ways. The second way that we do work together is around consumer awareness. And so, we have created some digital campaigns as well as print campaigns over the evolution of our relationship, really focused on sort of that key messaging of, making the healthy choice the easy choice, as well as, empowering individuals to make the healthy choice every day. The third area has been kind of focused on each other's employees' health and well-being. And so at the time that we made the commitment in 2015 to improve the health of all Americans, it really also was with the intent of providing adequate resources and support to each other's employees, and as well as their families' employees. And we continue to do that by sharing different resources and strategies. And then the last has been our community engagement work, which has evolved tremendously over the course of our relationship. And certainly through our community engagement work, we've been able to develop a number of different resources, including our community nutrition program. So on the next slide, we do give sort of a brief scenario of our community nutrition program, which is really, again, around changing that relationship with food and nutrition by inspiring individuals and families to make the healthy food choices an everyday part of their lives. And so we do that through engaging and empowering communities, particularly those that are at greatest need. Some of, enabling and working with community-based organizations like yourself to offer science-based and evidence-based programs. And then ultimately with that goal of equipping individuals with those new skills to make the healthy food choices for themselves and their families. So it has been a multi-pronged approach, and we can continue to work with organizations across the country, in terms of really making sure that they are aware of our resources and can certainly utilize those resources within their own communities. As a result of our relationship, on the next slide, we have developed, what we refer to as Turnkey Tools. We have truly built out an extensive, comprehensive curriculum of both educational as well as engagement experiences to help individuals discover, choose, and prepare healthy food. And we do that primarily through what we refer to as food discovery experiences. So all the educational lessons are designed in the exact same way so that they are interactive. They have a group activity as well, along with a demo, really with the ultimate goal of building food literacy for that individual. And certainly all the resources are based on AHA's science, as well as just our evaluation process continues to inform the skill building activities that are part of our Healthy for Life curriculum and materials. Because of our ongoing evaluation, certainly we have now been able to have Healthy for Life as part of the SNAP-Ed Policy System Environmental Toolkit, which may be a reference that some of you are familiar with, in addition to being a part of the SNAP-Ed resource library. So we're certainly very proud of the fact of how our materials have evolved over the course of our relationship working together, and certainly many of the organizations that we continue to work with have provided input based on participant feedback or their own personal experience in utilizing our resources. So we do really appreciate that. We also know that we've been living in extraordinary times. You know, certainly all of us have had to make shifts in our professional and personal lives. And certainly as a result of that, many of us have been cooking more at home. And, you know, that trend isn't necessarily going away. You know, certainly there are individuals that may not have always the means to have the types of foods that they would typically purchase. But yet, you know, our goal is really to equip individuals with the skills that they might need in terms of utilizing those resources once they are at home. So again, just really want to acknowledge the fact that, you know, while we've been living in extraordinary times, those times continue to, you know, exist. And certainly we recognize that the need that the pandemic has had on individuals' personal and professional lives. So with that, I really would love to turn it over to our first presenter, Tiara Turner, who again is with Catholic Charities of USA. Tiara?
Thank you, Heather. And good afternoon, everyone. Again, my name is Tiara Turner, and I am the AmeriCorps Program Manager with Catholic Charities USA. And CCUSA is a membership association where our local Catholic charity agencies, all of which who are independently 501c3 authorized by the local Catholic diocese and credentialed to work within their state, it's basically like a coalition where they are getting support and additional resources that they need from our agency. CCUSA members and agencies provide help and create hope for over 8 million people of all faiths and social and economic backgrounds throughout the country. So each independent Catholic charity agency has a population group that they work with and that they provide service to in their area. But our mission is to exercise leadership in assisting its members, particularly our diocesan Catholic charity agencies, in their mission of service, advocacy, and convening. So we, along with the local agencies, have a commitment to ensuring access to proper nutrition, whether it be through food pantries, food banks, community farms, or any other food and nutrition resources that's available in the community. Next slide, please. So to give you some background on how our program came into existence, we applied through the Corporation for National and Community Service, which is called CNCS, which is an independent federal grant-making agency whose mission is to improve the lives by strengthening communities and fostering civic participation through service and volunteering. So we applied for a grant opportunity to host a program that is centered around nutrition education. And in the spring of 2019, we were actually awarded $1.2 million in AmeriCorps funding, which supports our nutrition education program, a family strength and Vista program, a New Americans Vista program, and a peer navigator national program as well. What is not here is a program we were actually awarded funded for this spring, which is our financial education program. And we received over $600,000 to host that program for our local agencies. So what does all of this mean? So we get the funding as the intermediary agency, and we subgrant the funding to our local Catholic charity agencies for them to host an AmeriCorps member at their agency to fulfill the position in the particular program that the agency is participating in. So for example, like the nutrition education program, a member could serve at a Catholic charities in Ohio. This is just an example, and we would fund them partly for them to host that member there, to engage with the community members and to engage with their staff to fill that need and to hit the objectives of the program. Next slide, please. We are going into the Healthy for Life utilization, but before I dive into that, I want to just talk more about why we felt a nutrition education program would be effective and why it was necessary. So in 2017, Feeding America did a What is Food Security study, and they found that 1 in 8 Americans were food insecure, which equates to about 40 million Americans across the country and 12 million kids. So being a thought leader in all arenas when it comes to social services and just the betterment in the capacity of humans, CCUSA did propose the idea of hosting a nutrition education program, which members who serve in this program are responsible for increasing knowledge about the relationship between food and health for 1,500 food insecure individuals. And also they are to engage with volunteers as well to make sure that they are assisting in helping them teach nutrition education classes. So those are our program parameters. But that's not to say that's all members are limited to. Members do also have the opportunity to work with food pantries, distributions. They do a lot of work with gardening as well, and a lot of resource development for agencies and for clients too. Now, to transition to the Healthy for Life utilization. So pre-COVID, CCUSA usually has an in-person training for all of our site supervisors and our members who are participating in the program. And during that training, they learn more of a general information of what participation in the AmeriCorps program entails, and just the procedures and the policies of the AmeriCorps program in general. And then they also get a kind of detailed, refined overview of the American Heart Association training materials. And Heather has been a big help with providing us with that. She's taken the lead and kind of just giving them best practices for implementing the curriculum and just understanding how to engage clients with the toolbox that the American Heart Association provides for members to utilize. So members who participate in this program do use the American Heart Association's Healthy for Life curriculum as the primary curriculum. So that means that as a requirement of their service, they must make sure that the Healthy for Life curriculum is given to their clients. And that is how we measure our members' success with their performance targets. So they can use other supplemental resources, but since the Healthy for Life is already attested and proved to be a resourceful tool in other arenas, we made this the foundational curriculum for our program, and this is what members use primarily. So in the program, members have 2 metrics that they are trying to achieve. One is having to hit a set number of clients who attend the classes, the Healthy for Life classes. And then the second one is they have a set metric for the number of clients with increased health knowledge from their pre-survey to their post-survey. So what we do is before the members give a learning experience, they give all of their clients a pre-survey, just to assess what their knowledge level is coming into the course. And then after the course, they get a post survey to assess what they have learned during the course and just see where that course is providing them an opportunity to increase their knowledge base. Next slide, please. So this is an example from one of our previous members, Cassie. She was at Catholic Charities of Buffalo, and Catholic Charities of Buffalo runs 9 food pantries, and they do outreach in the Western New York area. 6 of their agencies, food pantries, participated in the Healthy for Life curriculum education that was provided by Cassie. And what she did there was engage participants in interactive activities such as food tastings and food demonstrations. And she also recruited and garnered interest in her next classes that were coming up. So at the end of each class, she did invite clients to sign up if they were interested in learning about a different topic. And she also provided them with recipe demos as well. So she would do a live instruction with the clients where sometimes they would get to interact and create the recipe themselves, or she would just do a demo for them at the front of the class and show them how to prepare that and let them taste it at the end. She also collaborated with their PR department, their public relations department, to advertise the experiences to their clients through the 6 pantries. And she also worked at food distributions as well. So when she wasn't giving the education classes to the clients, she also participated with the food pantry by doing senior meal distributions. And then especially when COVID hit, they did a high volume of food distributions for clients that were in need. To also make sure that engagement was high with her clients, she would stop at different points in her learning experiences and just allow for them to kind of engage with her and asking more in-depth questions about the nutrition value of certain recipes or certain foods that she was discussing, and just allowing them to have a platform to voice some of their concerns and health issues that they have seen prevalent in their lives based on the food offerings that has been available to them. Next slide, please. So since COVID hit, we have seen a huge impact on our members' ability to work with clients in person, of course, because of the social distancing aspect. So one of our members currently now, Rebecca, who's serving with our Catholic charity agencies in Central and Northern Missouri, created this flyer, and she sends it out via email, and they do also post it at their site as well. But essentially, she has made the transition to providing her Healthy for Life learning experiences in an online setting. And Heather did assist with that, with doing a demo for our members to see what that would look like if they did an online experience. This has been an alternative that has been effective for all of our members, especially the ones who are on teleservice and they are not working at their site at all. It still allows for them to have the ability to get in front of clients who may not regularly see them since they come in person. And then it also allows for them to do limited class sizes when they are in person, to have individuals sign up, of course, meeting the regulations of COVID of wearing their mask and making sure that they are distant. So what Rebecca does is she does a demo with the clients. She also talks about different health issues that are prevalent, especially in seniors, because that's the population that she works with. So an example for that is if seniors have diabetes, they focus that learning experience on foods and best practices for individuals who have diabetes. And she also does a modified check-in with them too. So after she does the class with them, she checks in with them and asks them about, of course, what they learned in the previous class, but what are they looking forward to with learning and engaging in these classes going forward. Next slide, please.
So again, I really just want to thank Tia for sharing. I will also mention that we have been working with Catholic Charities USA probably now for 3 years, even prior to the AmeriCorps funding that she had mentioned. So as we transition, certainly we have another poll, and some of you are already participating, so thank you. And so the question is really, how many people could be food insecure in 2020? So 25 million, 40 million, 50, or 60? So we'll just give it another second or two. And it looks like it's sort of tracking between 60 million and 50 million. So, based on the current analysis for 2020, there's an estimate of 50 million individuals potentially being food insecure, of which 17 million are children. So certainly we have seen a staggering increase number of individuals who are at risk of being food insecure or are food insecure. So with that, and we close out the poll, love to turn it over to our next presenter, Rebecca Collier. Rebecca.
Thank you, Heather. You can hear me, right? I came unmuted. Okay, thank you. As Heather said earlier, my name is Rebecca Collier. I'm the Nutrition Services Manager with Harvesters Community Food Network Food Bank in the Kansas City area. Can we go to the next slide, please? And today I have a few slides to cover who is Harvesters, kind of give an overview of what we do, the Nutrition Services Department specifically at Harvesters, and cover the use of Healthy for Life within our programming, what we're thinking about as we explore Healthy for Life, and also some benefits and challenges shared by past implementers and overall considerations when planning to implement Healthy for Life with food insecure audiences. Next slide, please. So Harvesters Community Food Network is a regional food bank serving 26 counties in northwestern Missouri and northeastern Kansas. Our service area is here on this slide. Our mission is to feed hungry people today and work to end hunger tomorrow. Harvesters is a food bank, not a food pantry. And so the vast majority of our time and effort are spent in support of our network of agencies who then directly serve those facing hunger in our community. Our network includes almost 800 nonprofit agencies, including emergency food pantries, community kitchens, homeless shelters, children's homes, and others. And adding in our Back Snack partner schools puts us at over 1,000 organizations in our partner network. And so most of our work revolves around this network and maximizing the capacity of our agency partners to meet the needs of our food insecure neighbors, and also partnering with community groups and organizations in order to meet our key mission initiatives of feeding children, feeding families, feeding seniors, and healthy eating. Harvesters Nutrition Services Department is focused on the mission initiative of healthy eating. Next slide, please. So while Harvesters has been in operation for over 40 years, the history of the Nutrition Department spans about half of that time. It used to be that the major focus was traditional nutrition education, which was carried out by a team that included a handful of staff and over 20 AmeriCorps members who were deployed all over the service area on that previous slide to teach classes within partner agencies and community organizations. In addition to the nutrition component, classes often included a cooking demonstration or hands-on recipe preparation. Nutrition Services used its own curricula, including different lessons for adults, teens, and kids, and multiple versions of each curricula that would rotate from year to year. So as you can imagine, over the years, there's been a lot of time and resources dedicated to the maintenance of the curricula so that it stayed relevant, effective, and up to date according to USDA guidelines. But over the past several years, Nutrition Services has incorporated a train the teacher element into the nutrition education programming, wherein staff and volunteers from our partner agencies and community organizations may be trained on and provided access to our lessons and supporting materials to provide nutrition education in their own settings. The addition of the train the teacher element arose as the Nutrition Services Department discontinued the involvement of AmeriCorps members in teaching classes, and the train the teacher allows for multiplying the effort of what is now a 4-person team. Additionally, our focus for the past 5 years has shifted to a more comprehensive approach that we call the Healthy Program Partnership. And through this program, Harvesters Nutrition Services and partner agencies work together to create and encourage healthier choices for agency guests. Next slide, please. Healthy changes that are made in each Healthy Program Partnership depends on the needs and desires of the agency. Nutrition Services team member works closely with the agency to identify those areas of improvement and create goals and an action plan. Environmental changes that nudge guests toward healthier choices, such as shifting to a client choice model, rearranging the pantry according to My Plate food groups, placing shelf tags with nutrition-based messages and encouragement, and providing suggestions on ways to combine available foods into a healthy recipe or meal are popular ways for agency staff to create opportunities for healthy choices. These types of actions also acknowledge the autonomy of pantry guests in making food choices for themselves and their families, and thus improves the dignity of the food assistance experience. Direct nutrition education is a component of the Healthy Program Partnership, and we continue to prioritize the train the teacher element due to having the small team for such a large network and the time and resources that are required by the Healthy Program Partnership approach. So this year, the Nutrition Services Department has been exploring ways to best use the time and resources that we have while increasing the reach of the Healthy Program Partnership initiative within our network. And when I learned about Healthy for Life, it seemed like a promising addition to our programming. The lessons align very well with a lot of our curricula, and we would also be able to redirect our time and effort away from revising, updating, and storing curricula and toward the execution of the Healthy Program Partnerships with our agencies. So in exploring this, we were kindly provided with contact information for a number of food bank and food pantry staff who had registered to use the Healthy for Life materials so that we could look into its use and effectiveness with food insecure audiences. The next slide is a summary of what was shared in these conversations. We could have the next slide. Thank you. So listed here are some of the positives that were shared with us as we talked with others across the country who have used Healthy for Life, and also some of the challenges. So those that we spoke of appreciated that all of the content was easily accessible online and that there are scripts to go with each lesson. This is especially helpful for those who don't have a nutrition education background or experience, having that detailed script. And with Harvesters, when we are doing our facilitator trainings or teacher trainings, many of our staff and volunteers from our agencies that we are training don't have a nutrition background. So it's very good that it's very convenient that these materials are very detailed and available online so that anyone can access them from anywhere. Others said that the availability of Spanish resources is a big plus. And several people mentioned that the lessons can be modified to meet the needs of different audiences, including guests and even the staff and volunteers at the food pantry or the food bank where they're working. Everybody mentioned the need for needs assessments that can determine which lessons are best for the specific audience. And one educator commented that trained staff at the pantry or the food bank can use their new nutrition knowledge not only for their own healthy choices and knowing what to cook and purchase and select to make a healthy choice, but also as a way of guiding their donation and food drive requests, and also knowing which recipes to feature within the food pantry. So I thought that was an interesting way that for using Healthy for Life, not only with guests, but also with the staff at the food pantry. The biggest challenge shared by those using Healthy for Life in food pantries and food banks is that participants, and sometimes even the educators themselves, have limited access to foods, ingredients, and equipment, and whatever recipes are chosen have to work within these limits. One educator commented that she has a very small budget for conducting the classes, and that there are some recipes that just wouldn't work within her budget. But everybody said, modifications can be made depending on the limitations that are in place. One educator commented that she often works with refugees and immigrant populations and experienced difficulty adapting the lessons to these audiences. She specifically mentioned that the recipes favor typical American food. Her word was they're very Americanized recipes and American ingredients. And that she had to find a lot of recipes from other sources to work with the audiences in her refugee and immigrant populations. Another educator commented that over a third of her clientele do not have internet access, which limits her ability to even communicate with them at all outside of the regular food distributions. So while this has been a year of virtual everything, and eventually much of the virtual programming will probably go back to being in person, the challenge of having reliable internet access will likely persist for this audience and has to be considered when planning the education. However, a couple of our agencies in the Harvesters Network did implement virtual education programming over the last couple months, and they were able to reach at least some of their clientele. So it just depends on your audience and your promotional efforts, casting a wide net to get the word out there, and just seeing who is available and capable of logging in to access the education opportunity. And the webinar that was mentioned, I think both Heather and Tiara mentioned it, the previous Healthy for Life webinar highlighted some of the lessons that would be most appropriate to implement in a virtual setting. And so that's a very helpful resource to have as we talk to our trained teachers about this resource and directing them toward particular lessons if they are implementing online. And the next slide lists several considerations when conducting nutrition education with food insecure audiences, and the considerations would apply in the virtual setting as well. And so the first one here, it's probably, if you work in a food pantry or food bank or with food insecure audiences, it's probably a no-brainer, but it's good to always consider choosing basic, low-cost foods, ingredients, tools, and equipment. Emphasizing that substitutions are fine. So if you don't have this brand name product or this brand name ingredient that I'm showing in the video or in the recipe demonstration, you can always use something else. If you don't have black beans, you can sub pinto beans. Making a point to offer these substitutions and not waiting for people to ask, well, what if I don't have that? Because a lot of people won't speak up and say, I don't have that. Just making it very normal and a very routine thing that you look at a recipe and it's not prescriptive, it's more a suggestion. This is how you can make this exact thing, but there's lots of suggestions and ways that you can change it up to make it work. And also equipment. One of the educators that I spoke with said, if there's a recipe that uses a food processor, I'm not going to demonstrate that recipe to a food insecure audience because you just don't know what equipment they have. And so trying to think about the lowest common denominator as far as what is most accessible to the most people. Even something like a whisk. If you're mixing up something, you could be using a whisk on the video or the demonstration, but say if you don't have a whisk, just use a fork. Lots of people have baked with just basic tools. You don't have to have anything special. to create a healthy meal. And so making that very normal that you would substitute equipment as well. Use ingredients found in the food pantry itself. That's a great opportunity for two ways. One is to showcase what can be created as far as a meal or a recipe from what is in the pantry. You're showing the clients of the food pantry, the guests of the food pantry, an interesting, possibly new way to use the foods that they have access to. And it also opens up a conversation again about substitutions. So say you were going to make a soup recipe and they didn't have the canned vegetable that the soup recipe called for. You could share that. Well, this wasn't in the pantry today, so I looked for another vegetable and this is what I chose. So it just opens up a conversation about substitutions and making things accessible to everyone. Choose recipes that include the hard 7. The hard 7 are long-lasting fruits and vegetables that we at Harvesters always encourage our pantries and other programs to use and stock for their guests. These include potatoes, sweet potatoes, carrots, cabbage, onions, apples, and oranges. So a wide variety there, a wide variety of nutrients found in that group of fruits and vegetables, and they last a long time. So it's great for someone on a food budget. Avoid or modify recipes that use expensive or rarely used spices. This is important. A lot of people don't have access to a wide variety of spices if they shop or get food from a food pantry. Food pantries don't always have spices available. And so this can be a limiting factor for people when they are trying to create a recipe. And so talking to people about, maybe try just leaving it out and seeing how the recipe turns out. Or if you have knowledge on what could be substituted, you can share that as well. But to think about someone, spending a few of their food dollars on a spice that they'll only use one time isn't a very effective use, efficient use of their food budget. And you'd probably rather have them direct those budget dollars to something that they'll use all of. So just again, trying to just find ways to substitute those things. And then overall, normalize being on a food budget, that it's a normal thing to want to save money while eating healthfully. And you can do that by all of these other tips, offering the substitutions, saying it's okay if you don't have that, you can use this. And so not waiting for people to ask you, but offering those proactively is important. Next slide, please. So the summary that we found through our kind of research with other food pantries and food banks is that Healthy for Life can be a useful resource for food pantries and food banks wanting to offer or facilitate nutrition education while operating on limited resources, including funding, time, and staff. Those implementing Healthy for Life with food insecure audiences must be aware of the limitations that participants may be experiencing and be willing to adapt to their unique needs.
Thank you, Rebecca. Really appreciate just the insights that you were able to gather and in talking with other food banks across the country and just, their experience in using the Healthy for Life resources. So just as we wind down, just want to kind of reiterate that, Healthy for Life has definitely gone through a rigorous assessment and evaluation process, which we are continuing to do. We have worked with over 800 community-based organizations across the country. Many of the educational experiences are recommended by other facilitators. When we have identified new educational experiences, we base that on feedback that we get from the community-based organizations that we've been working with. And so those 800 community-based organizations are really across roughly 90 different markets across the country. We go to our next slide. So I don't need to drill these points of success. Some of this was actually shared on our previous webinar, but for those of you who are continuing to offer your nutrition education programs virtually. These are just some tips and recommendations. Obviously, first and foremost, just being familiar with the platform that you'll be using, and certainly recruiting somebody else who can work with you during that virtual implementation. Certainly that person can also help troubleshoot if there is a technical issue while you are facilitating with your group. And certainly a number of the various technologies have tools such as polls as a means of just being interactive with the participants, and certainly keeping that group size really manageable, just to make it as fluid and interactive as possible. One of the feedback that was recently shared, as we had a number of organizations provide us with feedback in the early October timeframe, one of the suggestions was coming up with additional kind of prompts or questions that could be used regardless of the educational experiences that you are using, just because a number of organizations are doing this virtually, and as a way just to continue to, encourage participation amongst that group, is having some of those questions that could be used embedded throughout the duration of that virtual time together. So as we move, I think we do have some time for questions and answers. We do have some time for questions. As a reminder, you can log those questions in the Q&A function within Zoom. So I do have a question here that came in from one of our attendees. They are I want to help those that are seeking assistance, a way to learn how to make healthy meals with the food that are provided through pantry agencies. What is a good first step to engage community partners? Rebecca or Tiara, do you have thoughts on that?
I would say, a good first step would be when you can learn what, I'm not 100% sure if we're talking about we're talking about looking at community partners as a way to help agencies or help those seeking food assistance make healthy meals, engaging.
I believe that's what the question's asking.
Okay. One resource in our community, in our service area that we've made use of quite a bit is the extension service. So I don't know where you're located or whether you would have an extension service through your state university system, but that is a big resource for us because they have extension agents in all of the counties, and they have a lot of resources. SNAP-Ed Connection is also a great place to find out, or SNAP-Ed partners in the community, who, if you can find out who is conducting those kinds of education, they would possibly be a good resource for educational opportunities for those seeking food assistance.
Great.
And I'm sorry, ladies, my computer froze you for a second. But I hope I'm not just saying the same thing that Rebecca just stated. So to engage with community partners, I think she should, or he or she should probably just figure out, what's the population that's being served, to know what to offer from the food pantry, and know what's the palate of that community, to make sure that what you are offering is going to be something that the clients are going to engage, and then just try to, like Rebecca spoke to earlier, build recipes around those staple foods, or foods that are commonly in the pantry that will be beneficial for that client base.
Great, thank you. Again, if you have any questions, feel free just to log them in the Q&A. But as people are maybe thinking about their questions, I wanted to ask Rebecca and Thierry, what are some key areas to consider when you think about recruitment. And when I say recruitment, it could be to participate in a in-person class when it's permissible and we can do that again, or even recruiting to participate in a virtual. Are there things that, you know, agencies have learned that maybe be recommended in terms of recruitment?
In terms of recruitment, I will say, I know a lot of our members have expressed a lot of difficulty with translation. So maybe if there is someone who can act as a translator for a population that is being served, that would be helpful. Even with having the Spanish resources, a lot of the clients don't have the literary skills to understand what the surveys are saying. So they still would need someone there to be able to read it to them so they can comprehend what the survey material is stating. So I think that would be something that should be considered when thinking about implementing. And then also, I think Rebecca touched on this, like technology challenges while we're in the remote setting. I know that Rebecca, who is serving in our program with Central and Northern Missouri, she's faced challenges around getting higher engagement from the senior population because of the technology gap there. So just thinking about the population and how resources that we do have available, how there can be limitations in those resources, and just trying to think of an alternative when possible.
And I would add too that looking at how you can partner with organizations or agencies that are serving the same population that you want to reach. For harvesters, a lot of times we go through the agencies that are in our network. If we're wanting to do if we have an educational opportunity, we would start with the agency or organization that they're already engaged with. And, you know, we would talk to the person there and say, how do we reach this audience? Could you help us? And there could be other organizations, you know, senior centers where eventually when, it's non-pandemic time, seniors are gathering there for a meal possibly or something else. How can you leverage that? That's a place where they already go and they're already familiar, and as a way to provide this educational experience. So looking at where they are already and how you can reach them through partnerships that you can cultivate in the community.
Thank you. We did get another question that came in, and that is, have any of your partners developed sort of a go-to educational kit that would offer the supplies and instructions and maybe even a video just to learn a new skill or recipe? Have any of the agencies that you work with, have they done that?
I can say for us, our agencies haven't developed the educational toolkits because we use what American Heart Association provides for the learning experience. But we eternally CCUSA have made modifications to our survey materials just for implementation with our client base. We had heard expressed by a number of members that some of the questions were a little bit difficult to understand just from literary standpoint. So we made modifications to make them more simplistic. So when the members are engaging with their clients, they have an easier experience with getting clients to want to complete the survey. So that is one thing that we have done. But as far as recipe or instructions, that has been provided by American Heart Association, which has been really helpful. Heather, you did the demo video for us of how they would do a recipe if they were doing it virtually. And I think that was something that was really helpful for our members to share with their clients and learn how they should structure their videos if they're doing virtual distribution of the materials.
And at Harvesters, I'll say we have elements of this where we look for ways that nutrition education can overlap. So if we have any kind of pre-packed food boxes that go for particular partners, we look at how we could incorporate some nutrition education that way. We and our team, we've done a few videos on healthy and quick and easy recipes that are low cost. We partner with one of our extension groups here. We have been to create some healthy recipe videos. I don't know necessarily a kit where everything is included as far as, instructions and all of that. I don't think that any of our partner agencies, our pantries, have done that, especially this year. They have very little resource for, for these, creative type things. But that's one thing that we look at through our Healthy Program Partnership Program is creative ways to reach the pantry guests and the food assistance clients with nutrition education in all kinds of ways. So I wouldn't say, maybe the specific grouping that is referred to in the question, but we look at those different resources.
Great, great. Well, just on this question note, and I know we only have about 5 minutes left. If we could go to the next slide, I do want to wrap up and share some additional resources with the group. So one of which we have created some new videos, which we've been presenting on Facebook Live, and it really is a sort of a combination of both nutrition education along with culinary skill. It's presented by both a registered dietitian as well as a chef. And so, you can see the topics that are listed there. So if you are looking at sort of packaging up resources, including the video, these might be, videos to consider. As they air and become publicly available, I will be placing those on the Healthy for Life Facilitator Hub. So right now, what you can access are the two that kind of aired in October. So we actually have 2 more here in December, followed by 2 in January. And we did try to select topics that would be really relevant based on sort of the current time, but yet be evergreen, that they could be beneficial and useful, in the long run as well. And then lastly, I did want to mention that we do have a webinar that's scheduled in January. It's January 12th. It'll be at 2 p.m. Central. It is going to be focused around participant engagement. And so we actually have 2 more guest presenters. The first is going to be an individual from New Haven, Yale New Haven Health System, and then a second individual who is from Zion AME Church based in Alabama. So really excited to have both of those individuals really talk about their experience and how they've been able to utilize Healthy for Life within their communities, and then some of the ideas and suggestions that they would be able to offer around participant engagement. So again, really want to just thank you, Tiara and Rebecca, for taking time, sharing your suggestions, thoughts, ideas, and again, both the webinar recording as well as the PowerPoint will be shared out in the near future. If you do have questions in the meantime, certainly feel free to email us at healthyforlife@heart.org. And again, just really thank everybody for taking the time out and joining us today. Certainly, we can empower Americans not only to cook healthier together, but that will be not only now, but certainly long after the pandemic has subsided. So thank you again and enjoy the rest of your day.
Thank you.